This chapter is for the sense organs, which is the eye and the ear. If you follow along in your chapter with your textbook here, there's an introduction. We start with the eye. We go through the anatomy and physiology. I'm not going to take a lot of time to go through that with you. As you turn through the next few pages, it's great reading. There is vocabulary, which is always good. It kind of summarizes all that anatomy and physiology portion. And then we really get to our blue boxes for the eye, and we keep them separate here for both the eye and the ear. So when we get to combining forms, we have combining forms, structures, and fluids, first of all, as you'll see. So we have aqueo, blepharo. Okay, blepharo. It sounds like an F, but it's PH in there, so be careful with that. Conjunctivo, choro, corneo, cyclo, dacreo. Okay, and you see the word cry in there, and it is for the tears or the tear duct, so that kind of helps us. Iro or irido, corrado, lacrimo, and oculo. Ophthalmo. Now be really, really careful with this. Ophthalmo. Be careful with your spelling. It's O-P-H-T-H. Okay, O-P-H-T-H. I remember in my medical terminology class, we had to repeat that. O-P-H-T-H. O-P-H-T-H. She made us do it over and over and over. And to this day, when I'm spelling and I'm writing something, if I write anything without ophthalmo in it, I'm writing O-P-H-T-H, and then I could get the rest of the word. Really, really be careful. I want you to look smart with that and have that correct spelling. Opto and optico. Palpebral for eyelid is one that's kind of goofy. We just have to remember that one and really study it. Papillo for optic disc or nipple-like. Make sure you remember that papillo has two L's in it there. We have phaco and phaco with a C and a K, okay, talking about the lens of the eye, and you can see the two instances where they use each one. Pupillo, again, with the two L's, okay, pupillo and papillo. Retino, sclero, uveo, vitreo, and then we have for conditions, combining forms for conditions, and we have amblio, okay, amblio, which is very different, diplo, glauco, myo, midro, nicto, photo, presbyo means old age. So if you look at that term beside there, it's presbyopia. Really would be a old age type of blindness. And I had a student tell me once they remembered presbyo meant old age because their grandparents were Presbyterians and it looked like presbyo, and they thought that the whole church was filled with old people. Okay, so presbyo was old age. Scoto means darkness, zero means dry, and then we have some suffixes at the end, opia, opsia, and tropia. Errors of refraction are listed. It's good for you to read about astigmatism, hyperopia, myopia. That's the difference with the farsightedness and the nearsightedness. Presbyopia, okay, old age type impairment that can happen. And then pathology of the eye. So we've got cataracts, chalazions. They talk about diabetic retinopathy. Glaucoma has a good few paragraphs there for you to read up about. Hordeolium or stye. That's a good one to remember. A lot of people say, well, I have a stye or a stye in my eye. Okay, that's a hordeolium. Nystagmus. Okay, nystagmus is a kind of goofy word for you to be able to spell. Make sure you understand what that means. Strabismus, okay, an abnormal deviation of the eye or being cross-eyed. Okay. Then we get into clinical procedures with the eye. So fluorescein drops to dilate your pupils. We've had that done before when you go to the eye doctor. Ophthalmoscopy, a slit lamp. Okay, that's when the very bright light goes around in front of your eye and you just have to stare forward. Visual acuity test, and that's what that person is doing. You hold one, over your one eye and then you switch and you look at that chart on the wall. That's called the Snellen chart. That's a visual acuity test, and so it kind of explains that there, which is really nice for us too, if you want to take the time for that. We have enucleation, keratoplasty, LASIK surgery, and they talk about LASIK surgery and phacoemulsification there as well. And then we have a quick little tiny abbreviation box there for the eye, and really the only one, well, I put a couple here. I would kind of start HENT. Okay, head, eyes, ears, nose, and throat, can be negative, or you'll hear HENT negative when you read medical reports. So HENT is good. And then PERLA. PERLA is the other one. PERRLA. Pupils are equal, round, and reactive to light and accommodation. Okay, another very common abbreviation that you'll hear in medical reports. Then they split and they go to the ear. And again, a lot of anatomy and physiology here that I'm not going to take time to go through. You can read through the vocabulary on your own because it summarizes. And then we get to our blue boxes for the ear. And there's quite a bit of combining forms here. Acousto for hearing, audio for hearing, audito for hearing, oro and auriculo for ear, cochleo, mastoido, myringo, ossiculo, oto for ear, salpingo. So if we're talking salpingo and it's something and it's a female patient, we might be talking about the fallopian tubes. Here salpingo is eustachian tubes, and we're talking about the ear, the auditory tube. Stapido, tympano, vestibulo, and then we have some suffixes here. We have acussis or cussis, meter, and otia, O-T-I-A. Pathology of the ear, then we go through a lot of issues and problems that you can have. Tinnitus is a really popular one where you have the ringing in the ear, that sensation of noise. Otitis media, okay, or ear infection is what we call that with our kids, okay. Vertigo, that constant dizziness, okay, as well. Procedures and what they can do and things that they do for hearing and to hear the ear, and then at the end the abbreviations. I would say the most common abbreviation is the AOM, so the acute otitis media or ear infection. The EENT or the HEENT, again, the head, ears, eyes, nose, and throat. Okay? And then that's it for the sense organs, the eye and the ear.